for.
It's very
and
hard,
there's-
it's very
it
hard
can
to
be very
bring that
challenging.
in, yeah.
So,
And looking into the cost of this that we talked about, Rajni, how when people can't afford it, right, or they feel they can't afford it, you said there's options out there. Can you discuss some of the options that you guys see that are most common, that maybe sometimes maybe one that people don't really think about that is available to them?
Yeah, like for example, I would say respite. You know, respite care is a good way of coming and checking it out and have a temporary stay. And feel that, because sometimes families think, oh my God, this is the end of life. Once we move there, this is it. Maybe not. Just check it out per day rate and just come and stay there.
Is that one day? Is it a week? How long is the respite stay
We would
typically?
prefer a 2 weeks period, but there are many times when families only want for 1 week, and then we change according to the need.
Can you explain what respite means?
A temporary stay. So they don't have to be there for a whole permanent contract of 1 month at a time. They can basically say, I'm going to just try 2 weeks at a time.
So what I've
As
seen is that a family member who's providing the care, the sole provider living with mom, is getting to a point of maybe being burnt out. And so it's
Needs a
just,
break.
that person needs a break, they need to go on vacation, they need to relax. And so mom goes safely into, let's say, Coronado Retirement Village for 2 weeks. That family caregiver gets to rest, relax, refresh, and then decide, okay, we'll take mom back, we'll work on those options, and then look at maybe a more permanent option out there. And with home care, I know that the average is about 20 hours a week for about $3,000 a month in care. So if you're looking at a shared room at Coronado, that's about the same cost as 20 hours a week with home care.
Correct.
And so,
But you're getting a lot more.
so if you're a working family at home, if you've got kids in high school and you've got a mom that is now having dementia and delirium, those sorts of things, then maybe senior living is the perfect option.
It is definitely a very cost effective
Sounds like
compared to the
respite may
home
be one of the new favorite words in the county.
That's right, and I know that Diane Jacob did a study back in 2018 about dementia in San Diego with her team, and there are over 85,000 people in San Diego living with dementia in the county, and so about half of those people would be able to live in assisted living, but what happens to the 40,000 people that can't? And so I think respite is a perfect alternative for them when.
So they're not committing for a long term, they're only doing certain days that they need break.
Certainly.
And that way they both get used to the idea that, it's not like I'm gone from home forever.
Just to be clear, that's still cash paid by the family.
It is, but it's a little bit more affordable in sense of not taking a commitment of long term.
So it's the cash paid, they can either do, the other thing you said is long-term care
Long-term insurance is also paid for respite or permanent.
You guys mentioned another thing that was aid and attendance.
That's for our
What
veterans,
specifically is that?
for veterans get additional aid and benefit, and we definitely take that.
So that's for veterans that have served at least 1 day in an active war
duty.
period, active duty during a war. So whether that be Vietnam, Korea, World War II, any war,
Any service.
any service, that then they would qualify. And the spouse also has an opportunity to qualify as well.
The benefits.
How much benefit do they get?
It's up to $3,500, I believe, a month. So it actually could cover the entire stay of a shared room in some cases. So there are senior placement agents that have no-cost services that do help with some of those resources as well.
Application, yeah,
And with
for
those
applying,
applications.
yeah.
And so that'll be for a whole other show, and we'll talk about that later. But truly a lot of resources in the community that, especially for our seniors, from Balboa to Camp Pendleton to Miramar.
There's also the PACE program now that is also helping, paying for services. And in San Diego, they have a pretty big,
There are several PACE programs in town, and PACE is a program for those that are aging in the community, and essentially they sign over their Medicare benefit, and PACE then manages their entire experience. So that's every doctor visit for adult day programs, their lodging as well. And so some PACE programs in the county have opted to pay for rooms at senior living, and some health insurance plans have looked at that as well. So there's a program called CalAIM that's coming out in 2022, where the government is looking to start paying for assisted living beds. And why that's important is that what we're talking about today is private pay, and those that have saved money, whether it be long-term care insurance or served in a war and have that ability to pay for
And
senior
some
living.
families also supplement.
Right, so families can supplement as well. People that don't have $3,000 a month, then they by 2022 will now have different options with different Medicare
Oh, good to know
Advantage
that.
plans. So we'll talk about that later. And so we're wrapping it up on this segment. And again, we want you to email your questions to info@hcshow.net. And we're here with Rajni Shakabanda from Coronado Retirement Village, and Dr. Castillo, Ed, and I, and we'll see you on the other side of the break.
Thank you.
How we doing?
Okay.
Just great.
So I think you're doing awesome.
I hope I have the true facts, but it's $5,000 for what we pay the rent in that building, Dr. Castillo. People are shocked to know how we manage. It's
Yeah.
because our overheads are dealt with our own,
I
very
mean, I've seen
hands-on.
like homes that, assisted living facilities and independent homes all the way up and down the county, and some of them charge up to 8 to 10 grand a month.
Yeah, well, it can come to $8,000 if somebody has like for level 4 with employer transfer and all that, but I'm talking about a moderate, like a 2 times a week bathing, supervision, laundry.
So you said that there's no difference in charge across levels
Yeah,
of
so if
care,
they are in
whether-
memory care or they are in assisted living, as far as the care level would not be different. The cost of charging for their bathing or their incontinent or their medication is not gonna be different. It's gonna be same. It just, every level is just determined upon the assessment. So if you go and assess them and see that,
If they're total assist versus.
yeah, like for many facilities, they would do scoring system. We do scoring system to know where they stand, but we don't charge by scoring.
So what are we gonna do here? Tie it all back together?
So I want to kind of tie it all back together with telemedicine, Autumn Care, and remote patient monitoring.
I don't care something we never discussed what it is.
Right?
We
It's-
brought it up, but we didn't really tell.
But I
about
love it, right, because it's now families have different levels of care, right? So it's someone's in assisted living, but someone maybe needs memory care.
So autumn care is basically coming as a transitional. You have dementia, but you're not eloping. You don't have wonder risk. You just are cognitive, constantly checking on you.
Yes.
So you don't need to be in a locked unit.
Gotcha.
So we have this designated area of rooms.
So we'd say locked or secured unit, is that synonymous?
Locked and secured is kind of synonymous.
Okay,
yes.
gotcha, okay.
So autumn is more like autumn, like
Right.
you're in between.
It's
a
not
trans-
winter, it's autumn.
And the
right?
denial, like mom doesn't need to be in a locked unit. She can easily be out here with
Right.
other, population.
Different
But then
activities.
we just have a wander guard tags on them, so we kind of know that they are to be monitored more closely.
Make sure spend about eloping, as people think that's going off to get married.
Right, right.
Well, wandering,
Yeah.
wandering.
Right.
Wandering, not.
So, excellent.
Yeah, that's true.
And bring up that joke if you can, right? No. About eloping, right? So,
They're not quite wandering.
Right,
And they're
right.
not in that high care, but they
They're
are
trying to-
still very early stage of dementia.
So, excellent. I think we're, are we ready?
Let's do it.
So last segment, you're doing great, Rajni. So this is great. Welcome back, everybody, and we're excited to be here with the owner-operator of Coronado Retirement Village, Rajni, and Dr. Castillo, and also Ed. And so in this last segment, we really want to tie everything together. We've been getting great tips and tricks on when we need to go evaluate an assisted living, when's mom ready, this concept of respite care, and allowing that family caregiver the time they need to relax and make a better informed decision about what's best for mom instead of a rash decision. And in this last section, we want to tie it together with the proactive thinking that we want to share here on the Healthcare Corner, which is how can we help you, the listener, be a better consumer of healthcare information. And so there are two things that Rajni's doing on her campus that we wanted to bring up. One was Autumn Care, and a concept of taking a family of loved ones, maybe one with dementia, one isn't, so you have maybe potentially a separation of a couple that's been together for decades, and then another one on vitals monitoring and how that's helping her get better outcomes and having people age in place longer and enjoying the great benefit of her community. So Rajni, would you maybe start with Autumn Care and kind of that difference and what trailblazing effort you've made that way?
Right, so as I said, majority of my decisions and factors of running this business comes from what I feel at home with my parents, with my loved ones. I put myself in the shoes and try to make the decision based on that. And I realize many of the residents who are coming, and you know, dementia is very vague, as Doctor would know, and so it's like, you know, you say dementia, it's like, what? Not everybody falls in the category of being in a locked unit.
Right.
So for many residents who come in like 70s and 80s and like they have cognitive decline, but they don't necessarily are wandering or a risk of flight, you know, leaving the building.
Or eloping, and for our listeners, that's not getting married, right, Dr. Castillo?
That's right.
That's right.
Right. That's right. Well, we have a lot of love in our community. So in that respect, I think Autumn Care came kind of one of the designated section or rooms in the community that we kind of keep aside with residents who can be under the dementia, but they have some wonder tags on them, and we watch closely and monitor them to see if there's a need for anything that is declining more to go for memory care, or they stay there for many months and years. And they are part of the regular main dining, going there and going to the main activities, doing everything with the regular population. And that's very important for me if I was placing my loved one, to know if it's not time for everybody to, just because it's a dementia diagnosis, put them in an locked unit.
Certainly, and I think that care is always individual, right? Last week
It
we
is.
talked about
Custom tailored.
we can't take the human touch out of healthcare, and I think when you look at dementia